Shortly after delivery, your baby's height, weight, and head size are also checked. While this is a routine procedure, when these tests are done does vary from place to place. Some parents request in their birth plan that these procedures are delayed until after the first hour of life. Because bacteria in the birth canal can infect a baby's eyes, your baby will be given antibiotic eye drops or other physician-prescribed medication, either immediately after delivery or later to prevent any infection. Another common procedure is giving babies a vitamin K shot. Vitamin K is necessary for normal blood clotting. When babies are born, they have low levels of vitamin K for the first few weeks. Another shot is the hepatitis vaccine. You have two choices for when to start this vaccine, either at birth or at the 2-month checkup. And depending on where you live, your baby may be given a hearing test. Some states require this early screening to help identify children at risk for hearing difficulties while they're still very young. If you have chosen to bank your baby's cord blood, your obstetrician or midwife will clamp or cut the cord and then collect the cord blood. The blood will flow into the bag by gravity until it stops. The actual collection typically takes...
Now, the whole time they showed that video of the baby getting 2 shots, of getting all sorts of goop poured into his eyes, you'll notice that they only showed the video. They had no audio that was muted, so you couldn't hear the baby screaming in pain. This is why you don't ever give birth in a hospital. The baby is scared at birth and needs to be with its mother. Is this appropriate to take it away and start giving it vaccination shots? Do you know how dangerous vaccination shots are? If you think so, the following video is for you. Let's remove this DVD and put in this old tape now and see what it says.
When you put the baby back down in the water and talk to the baby, this baby ends up just opening. It's what we call enfoldment. And the baby just relaxes, and you can see this baby doing that right in front of you.
For so many years, people thought babies didn't feel pain at birth. They were too little. They didn't experience pain. In 1989, the American Medical Association declared the obvious: babies do feel pain. And in fact, the studies that they've done did use circumcision, and they also came to realize that not only do babies feel pain, they feel it more exquisitely than older babies, than children or adults. So we know now that babies feel pain profoundly, and circumcision is clearly an excruciatingly painful experience for babies.
Having a baby is an important part of the life of the individual and the life of the family. And unfortunately, all of modern medicine and modern technology has tended to turn it from an important family and social event into a medical phenomenon. So now pregnancy is an illness and birth is a surgical procedure. And that is more true in America than in any other country in the world. And one of the reasons that it has gotten so out of hand in America is because America does not have an absolutely essential component of maternity care. An accident of history 100 years ago, they lost an essential component that provides the right balance for the best maternity care. They lost midwifery. Because in those countries in the world that have the absolutely best track record for maternity care, in other words, lose the fewest babies, and have the best results, all of those countries have a system in which you have, on the one hand, very, very highly trained obstetricians taking care of all of the complications, thank God, and on the other hand, you have the midwives doing all of the care of normal pregnant and birthing women. And that brings the balance together. And if you don't have the midwifery, then the teeter-totter simply goes completely out of kilter, and you get an overwhelming unnecessary use of technology. So, for example, in America today, close to 1 out of every 4 women has their babies cut out, called cesarean section. And if you add to that the women who have their babies pulled out by a forceps or vacuum, what you have is that about 1/3 of all babies born in this country are cut out or pulled out. Now this is madness. This is utter madness. There's absolutely no medical justification for this.
My 2 previous cesarean sections I felt were unnecessary. It made my birth experience very negative. With my second cesarean, the baby was in no distress, neither was I. I communicated to the doctor, the anesthesiologist, my husband, and the labor nurse. I did not want to have a cesarean section, and I got one anyways.
Woman after woman after woman, grandmother after grandmother after grandmother, having given birth vaginally. How can it be that from 1975 to 1991, in this one country, we have changed it so that 25% or more women cannot give birth in the way that women were created to give birth? We were born to have babies.
Yes, it's a simple solution from the point of view of what's needed, but how to get it to happen, the strategies and all the rest, are very complicated because you're going to deal with an absolutely obstinate obstetrical profession, because this has got to do with territory, this has got to do with power, this has got to do with control, and at the end of the day, it's got to do with the money. And I do believe we'll do. We will find a way.
Here it is, 9 pounds, 6 ounces. Yeah.
Well, it was hard. It was a lot of hard work, but I got it done.
I long to see the day.
We have an opportunity, if not an obligation, today in the 1990s to co-create a new system of health care for birthing women. A system that acknowledges that birth is a normal physiological process and not a medical event. A system that recognizes that midwifery is the best possible care for birthing women. And a system that allows women to choose how and where and with whom they have their babies. We have the answers.
It takes to make it all.
Being confined to a small room, subjecting her to the sounds of other women in labor, especially the screams of other women in labor. In a threatening environment, it's just more difficult to give birth, and therefore what we find is the use of many more medications, narcotics, and epidurals in the hospital environment. In the home environment or in a birthing center environment, there's a lot less medication used, and therefore labors go more rapidly and generally much more easily.
My first one was in a hospital setting. It was cold, white. I felt so like I was freezing. I shook constantly. With this birth, it's so warm, and it's like I was right in my own